Hi, fellow Lyme people. I am making this video because when I went to to research and to understand what was going to happen to my body when I had a PICC line put in, there wasn't a lot of information. So I hope that this is helpful to someone else. First of all, if you are unfamiliar with the PICC line, it is a line that goes basically from this vein and it runs up through the arm and then it arrives down into the aorta. So there's inside of me, there's a fairly long line that goes there. When you have this done, you'll go into a facility and she or he will use a device like an ultrasound that will locate your vein, and they will use that as a guide to put the line in. As a heads up, helpful tip, you will not feel pain necessarily in the vein because veins don't have pain sensors. I didn't know that. That was very reassuring. I did, however, post PICC line placement, have some discomfort. I iced it for about 24 hours, mostly at the actual site where it was installed. So just as a heads up, when you go in, they'll put a sheet up so you don't have to look if you're like me and don't like looking as they put it in, and they will give you some lidocaine first, so you'll have that discomfort, and then after the lidocaine, it'll feel more like a pressure versus pain when she's putting in the line. And then, like I said, afterwards, the site itself was a bit sore. And ice is your friend. You don't want to get it wet, so you want to put a towel over it, but ice does help with, inflammation and that sort of thing. And I had to use ice at different times. They change these weekly. And sometimes when they change it, something gets a little pulled, or just by living your life, you may pull your line. That's something I wish that I would have known. For example, in the course of the last 6 weeks, mine has moved about 2.5 centimeters. And honestly, only once did I feel it move. So that can happen just when you're sleeping, if it's not covered, just in doing life. Even moving your arm overhead back and forth, that can it can make things move a little bit. So you do need to be careful with this. So things to know about a PICC line. It's not that bad having it put in. It's not like it's a ton of fun, but it's not hugely painful either. I would probably say it was maybe a 5 on the pain scale for me. Maybe a 4, maybe a 6, and then it went away. And then afterwards, it might have been like a 2 or a 3 for the throbbing. So, and I had an absolutely wonderful person put mine in over at Upstate. Her name is Jan. If you ever need a PICC line put in, go to Jan at Upstate Infectious Disease. So, okay, so then what you're going to do, what happens after you have a PICC line? So you will have a home nurse come, and they will tell you everything you need to do and that sort of thing. You'll also have a delivery generally. They delivered most of what I needed in this box, and what's in here are alcohol swabs. And in my case, what I use is a saline. I have the actual antibiotic, which I am using what's called Recefrin, and then there's a heparin. So if you're giving yourself your IV, this is what you're going to do. So first of all, there's 2 places. I do my own. If you have 2 choices. You can either opt to do it yourself or have a loved one do it for you. So I'm doing it myself, so my line is a little bit longer. And there are 2 places that it stops the line, so that these are one-way lines. They can only go in, they don't go out. This on the end here, there's a stopper that you have to push in on for the liquid to go in. So it's relatively safe from outside elements getting into your body, because this does go directly to your heart. So you need to be very conscientious of that and very careful, because obviously infection would be extremely bad and dangerous. So, okay, so I'm gonna open it here, and I'm gonna open it here. And then in order to actually give myself the dose. It's pretty easy, so I just thought I'd share for those of you who are curious before you have to, begin to ease your fears. They're all encased, and the medicine itself, the antibiotic, this you keep it in your freezer until 24 hours ahead of time, and then you place it in your refrigerator to slowly defrost. Anything going into your body, it's always more pleasant if it's at room temperature. So after it's been in the refrigerator, you're gonna leave it out on the counter for maybe 15-20 minutes until it comes up to temperature. And that'll just be more pleasant because you do feel it going into your body. And then I have 4 alcohol prep pads that I'm going to use. I washed my hands before I started. I also have some hand sanitizer here that I can use again beforehand. So you're gonna unclip. You're gonna take your alcohol swab. And actually, I should probably slow down and show you this little sheet I have. It says DASH, which stands for, first you do the sodium chloride, then you do the medication, then you do the sodium chloride, and then you change it with, you go to the heparin. So that's the order that I use in doing this. Okay, so I'm gonna rub this for like 15, 20 seconds, just to clean it off again, just to be extra careful. And then I have my little bin here for all the waste. Unfortunately, it's not very environmentally friendly. There's a lot of plastic. So this is your saline, and then you're going to draw it back, because if you don't do that, it'll go spurting up in the air, which I don't recommend. Then you're gonna push out the excess air, and then I flick it to try to get the bubbles to come to the top. You don't want those air bubbles in your line. So there we go. Then you push in slightly, turn, and you're gonna do a pulsing action. So push, pause, 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 push, pause. All done. Not a big deal. Then you're gonna take your second alcohol wipe and do the same. 15-20 seconds. Wipe it down. This is the actual medication. Same thing, draw it back, and then slowly ease out the excess air bubbles. I have a paper towel handy for if I get a little bit of liquid down. Now this is a little different. You need to, at least I was instructed that I need to do it over the course of 10 minutes. So there's 20 ounces, milliliters. I'm sorry, not ounces, milliliters. And so for every 30 seconds, I'm gonna do an ounce. So what I do is I set a timer, and I just, every 30 seconds, I slowly push an ounce into me. And I'm not gonna have you guys wait during this entire thing, but it's not difficult. I usually do something nice for myself, like listen to a podcast when I'm doing this, or talk to a friend. So it's something I don't exactly look forward to it, but something that is a little me time. And then after I do this, it's going to be a repeat of the other two. So then go back to you're gonna flush the line again, and that's with that pulsing action, push, pause, push, pause, push, pause. And then you're gonna clean it again with your alcohol wipe, and then go to the heparin, which is a blood thinner. And again, you're gonna do push, pause, push, pause, push, pause. And then you're done. That's it. You're gonna close your line, that's important, and roll it back up. I use a sleeve to protect the line. It's kind of ridiculous that they're spending all this money, personally, my opinion, on this IV treatment, thousands of dollars, right? Home nurses and all that. And they don't give you really a sufficient cover for making sure you don't yank it out. But what this is basically just a sock, nice cotton sock, a long one where I cut off the end. And this is really great for covering your line so that it doesn't get yanked. There are other ones you can buy on Amazon. I have a nice flesh colored one when I go out, so it looks less obvious, but honestly, it's not nearly as comfortable as this cotton sock. So this is what I use during the day when I'm not out and about, and also when I'm sleeping. Another tip is these little bands that you can use for your hair. If you happen to have allergic response to the bandage, which is actually not uncommon. I had to change out the type of dressing that I used because I had bumps all over underneath and my skin got angry. Mostly because you've got to think that this is on you all the time and your own sweat will get trapped under there, but also the glue of the bandage can also be irritating. So I had several weeks where I had kind of bumps going on, an allergic response, and so it felt more itchy to cover it when there was heat. And so I use these. You can roll up your line and use that to keep it in place. Again, when you don't want to do that when you're necessarily sleeping or being active, but just day to day if it's relatively safe. This is a good alternative. I've even used medical tape just to tape it up when it was uncomfortable to cover it. So I hope all that is helpful. Again, when I was looking, I didn't see a lot of resources. So I hope that's helpful to somebody else. It's not that big a deal as far as pain goes. It's less scary than what I thought it was going to be. You will get through this, and I wish you healing. If you have any questions, please feel free to ask. I'm not a medical professional at all. I'm just somebody who has lived through it. And I wish you the best. Take care. Bye.